Howdy folks, my name is Mars. I'm a physical therapist. I'll be your last speaker here. I'll try to get you out of here before. I've been a therapist for about 20 years, but I've been working here at Kaweah for about 10. So although I'm a physical therapist, they did ask me to talk to you about an occupational therapist. So an occupational therapist is a therapist who deal with what are called activities of daily living. So how to toilet, how to get dressed, how to shower, okay? So bear with me here. Okay. So the first thing I'm going to show you is my demonstration table. So for occupational therapy, another thing that they deal with is safety during your activities. For example, right now, a lot of you are probably taking showers standing, but it might be difficult after your hip or knee surgery to be able to wash the bottom of your foot. So those are things. Really quickly, how many are getting hip replacements? So we're all knees today. Oh, one hip and the rest are knees. Okay. So the first thing I will show you here is something called a hip kit. So although it's a hip kit, it's also for anyone who has difficulty reaching their feet, okay? Especially when you get dressed. So in there, we have your handy dandy reacher. I think a lot of people know what reachers are. So if you need to get anything from the bottom or from the top, that's your reacher. Long-handled shoehorn. I think we're still in a population, we know what shoehorns are and how they're used. So long-handled shoehorn. Long-handled sponge, so you can wash your feet. Also for hygiene, one patient use only. That was a joke, but anyway. This is called the dressing stick. So, for example, if I'm sitting on the toilet and my pants get to the ground and I can't reach them, I can use that to pull my pants up or to push off my shoe if I need to do that. So we usually let patients kind of use a dressing stick. It has just a couple of hooks here, so you kind of figure out which hook works best for you. Now this is called the sock aid. So I'll show you how this works. So if you can't get down to put your socks on, you use this contraption. So you get the sock and you put it over this contraption here. Okay. And that goes to the ground. You put your foot in there, and then that pulls that up there, and then you can use your dressing stick to do that. Okay. So the reason why I'm showing you this, if you're having difficulty getting socks and shoes on, and if there's something on here that you may need for your upcoming surgery, now is the time to go shopping. Okay, you can get these things at Walgreens, the Walmart, or the Bone Store. The Bone Store is now located on Caldwell and Demery. Okay, but if you're pretty savvy online, you can find these online. I think Amazon Prime has really good prices for that. Okay, these things, which maybe about 5 years ago they were covered by insurance, but they're no longer covered by insurance. Okay. So the next thing that I'm going to show you are just for showering and bathing. So if you have a shower stall where you just walk in, okay, you can just purchase a shower chair. So that just fits inside the shower, okay. And we would recommend that if you can replace the shower head with a handheld shower. That's usually a pretty easy fix if you haven't done that yet, okay. So this is a shower bench. Now if you have a tub shower combo where you have a tub and you turn the diverter to make it a shower, it might be difficult to step over into the tub. So we get this, what's called the tub transfer bench. So 2 feet will go inside the tub, 2 feet on the outside, and then you can adjust the height as you need to make it more level. So once again, instead of stepping over, you just come sit on here, and as you bring your legs into the tub, there, you take care of business, shower, 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 and then coming back out that way. Okay, called the tub transfer bench. The next item up for bid is called the 3-in-1 commode. So as the name implies, there are 3 uses. So this can work as a bedside commode, so you can put that by the side of the bed. And if you need to get to the bathroom quickly, you have this. Recommend that you change out the tub once in a while. Okay. Okay. Or it can function as a shower bench. So you can put this in the shower, and then boom, you have a place to sit for the shower. The other function is most toilets are rated at 17 inches height. Okay, and if that's going to be pretty difficult for you, especially for a tall patient, you can put this over the toilet, raise the height of it. You take the tub out, put it over the toilet, and now you've raised the height of your toilet. Okay. The other option that you have is to use a raised toilet seat, and this fits right on top of the toilet with a clamp here that clamps down right on the toilet bowl. So once again, you've raised the height of your toilet. Okay? Now, once again, the reason why I'm going over these things is because these things used to be covered by insurance, but with the changes of insurance and equipment, these are no longer covered by insurance. So if you feel that one of these things could benefit you before your surgery, now is the time to go shopping. Okay? Yes?
I do have a question. We do have a shower stool in our shower that we've been using, but it's just a little round, stool to sit on.
Okay.
Would that be, I mean, he uses it now.
Okay. As long as it's sturdy enough for him, that will work.
Okay.
Okay.
I just wanted to make sure.
You may want to do a dry test run before this.
Well,
oh, you're using it now. Okay, there you go.
I'm in trouble I have to getting over that little.
That lip, the shower lip.
Yeah.
Yeah.
I have grab
But
bars.
we have grab bars.
Okay, well, good.
So,
Good.
you know.
All right. Anything else before I move on? Thank you. So this slide is mainly after your surgery, they're talking about a 1 to 2 day stay at the main hospital. Yes? Is that about 1 or 2 days? Okay. So just keep in mind that when you're ready to go home, we want to get you to outpatient therapy as soon as possible, because in outpatient they have a lot more equipment available. The therapist can deal with it, whether it's a range of motion issue, a swelling issue, pain issue, and then also in outpatients where they will work on getting you off the walker to walking with a cane or without the cane, because that's your goal. Your goal to get these joint replacements is not to stay on a walker, it's to walk beyond that. Okay? If you're having difficulty after your surgery and the doctor feels it's a lot more necessary to have home health, they will order home health. But also keep in mind their goal is to get you to outpatient as soon as possible. Okay. Any questions so far? If not, if you could turn to your booklets, we're going to talk about some exercises. So page 26 for the hip, and page 35 for the knee patients. Demonstration table. So the first exercise on there are called ankle pumps. Okay, and like the name implies, you're just going to pump your ankles up and down. Okay, just like that. You can all do them together or alternate them. It doesn't matter to me. The main reason we're going to do this is because after your surgery, you're going to have swelling in that leg. So this will help with the swelling. But the most important reason is that you will not be walking near as far as you're walking today. Today you came in from the parking lot, so at least 300 feet to get into the building, into the room. You're probably not walking 300 feet day 1, day 2, okay? That puts you at risk for getting a blood clot because you're spending a little bit more time in bed after a surgery. If you develop a blood clot in your legs that travels to your heart, you get a heart attack. If it travels to your brain, you get a stroke. If it gets into your lungs, something called a pulmonary embolism. You're gonna have enough problems as it is for your knee or your hip, pain and incision and all that. You don't need a blood clot going through your system. Okay? So all the time that you're awake, sitting down, laying in bed, sitting down, watching TV, just pump your ankles up and down. Okay? The next exercise on there that I'm going to show you are called bed-supported knee bends. In physical therapy, they're called heel slides. And this is the movement. You're just going to bend your knee up and then down. And the knee patients will say, will I be able to do that after my surgery? Now, let me explain it this way. The morning of your surgery, you have a certain amount of strength in that leg, okay? The afternoon, you haven't suddenly lost all that strength. What you have lost is the control to those muscles. So by doing this very early on, you're telling your leg, if I need to bend my knee, these are the muscles that I use to bend. If I need to straighten it out, these are the muscles I need to straighten it out. Okay, so it's more of a muscle re-education type of exercise. The next exercise on there are called buttock contractions. We call glute sets. Do I need to demonstrate this one? Okay. All the ladies say, yes, yes, please. Yeah, really? So, yeah. So all you're going to do is you're going to tighten your buttocks muscles like you're holding a bowel movement. Count to 3, twinkle, twinkle, little star, and then relax. Even for hip patients, this is not a very painful exercise, but it gets those glute muscles ready for when you start walking because it's your prime muscle that keeps you upright. Okay? The next exercise on there is called abduction. In the world of therapy, abduction means to go away from the middle. Okay? So this is the movement, out to the side, and then back. Okay? And then a hip patient will say, will I be able to do that? Once again, this is more of a neuromuscular re-education type exercise. So if you need to go out, these are the muscles we use to go out. These are the muscles we use to come in. Okay, the hip abduction exercise. Okay. The last exercise I'm going to show you today is called the quad set, more specifically toward our knee patients. Okay, so I did lotion, so we are good. So your quad muscles are the big, strong muscles in the front part of your thigh here. Okay, and to do a quad set, you're going to tighten that muscle, and as you hold it tight, you're going to push the back of your knee down into the bed or into the mat. Okay. I need to go around the room and make sure that all the knee patients know how to do this, so I'll be doing a quick demonstration. You're the only hip, right? Everyone knows this. Okay. I'll start on this side. All right. Any questions about the exercises? Okay. When do you think I'm going to tell you to start doing these exercises? Yeah, tonight. Okay. For a couple of reasons. First of all, as a physical therapist, I'm going to deal with you after your surgery, whether you're hip or knee. And I'm going to deal with the pain, the swelling, incision, and all that. So, but if I'm also dealing with muscles that are weak, your rehab will be a little bit longer. So we want to strengthen those muscles as much as possible prior to the surgery. Second of all, we want you to be familiar with these exercises. So when the therapist comes into the room and says, okay, I'm Mars, I'm going to be your physical therapist. Let's start off with some ankle pumps. Oh, I already know them. I've been doing them while I was waiting for you. Oh, very good. So you already have a head start. And some of you, if you can remember when you wake up in recovery, oh, I need to do my ankle pumps, or I need to do my glute sets. Okay? So we want you to be familiar with these exercises as much as possible before. Thirdly, it's kind of mean, but you're going to get that joint replaced anyway, so do the exercises. Okay? So anyone getting their surgery here on Monday? Wow, 2 on Monday already, huh? Okay. So you guys win the cake. All right, so you have 3 days, 3 days to really work on that. Okay. I'm going to show you a model of a knee first. We'll do the knee. So this is a right knee. Okay. I am not the surgeon, but I'm going to talk to you about the principles of the knee replacement. Okay. So they make the incision over the kneecap, okay, to expose the knee, okay. The bone here, the femur bone on top, and then the tibia bone on the bottom, all the lining there of cartilage has been worn away. That's why you're getting a knee replacement, okay. So when they go in there, they go to the top bone, the femur there, and they shave it and shape it so you have an artificial template that goes right there, okay. They go to the bottom bone, the tibia. Once again, all the cartilage is worn away, so they will shape it and fit an artificial template on top. So you will have artificial on artificial, okay? And then the kneecap, if for some reason the kneecap's in good condition, they'll keep the kneecap. If not, they'll either replace it or resurface it. But once again, that's the discretion of your doctor, okay? So that's the knee replacement. Okay. And this is the hip model. So this, in this case, is a left hip. Okay. All right, sir, I guess for you. So the reason why you're getting the hip replacement because the ball is all worn away and the cup is all worn away. Okay, so they open up the hip joint, okay, and they put an artificial cup on the inside, right on the pelvis, and then they remove the ball that was on the bone here, and then put this artificial prosthetic which has a stem that goes down into the marrow of the bone, okay, and then that fits right there, and then they sew you up and send you recovery.
Yeah.
Okay, those are the hip and knee models. Once again, I can't tell you what material the doctor is going to use, how long is incision, but if you have more specific questions, then you'll have to talk to the doctor. Okay? If you're brave enough, then you can go on YouTube and look up those surgeries. Okay. Yeah, if you're brave enough. So the next element on there is weight bearing. So after your hip or knee surgery, I'm expecting 95% of you to come out of that surgery being able to put your full weight on that brand new joint. Okay? I say that because I have some patients say, well, I don't want to put too much weight on it because I don't want to ruin my new surgery. No, it's built for that, folks. They've been doing this for at least 50 years, joint replacement, so they've had time to improve upon it and make it as easy for you as possible. So expect to put your weight on there. All right, 6 to 8 weeks, what does that mean? With any orthopedic condition, whether it's a fracture or joint replacement, it's going to take 6 to 8 weeks for bones to fully heal. There's no exercise that I can give you to make that go faster. There's no medication the doctor can give you to make that go faster. So what does that mean? For 2 months, you're going to be sore. Okay, so here we are in September, end of September. By Halloween, everything should be healed by then. Okay, but the good thing about orthopedic conditions is that as things are healing, your movement improves, your pain gets better, as opposed to getting diabetes or a heart attack or Parkinson's, which stays with you for the rest of your life. Okay, so don't cancel your Christmas trip to the Bahamas yet, because you may still be able to go. Yes, ma'am.
Is there a excessive amount of pain when you stand up in that joint?
It's hard for me to predict people's pains. Okay, some people can tolerate a lot more pain than others. People are a little bit more motivated than others. You know, oh, I really need to play with my grandchild. That's why I'm getting this joint replacement. Also, if you've been dealing with a hip or knee pain for 20 years, and you've been walking like this for 20 years, there's a lot of muscle imbalance, not just pain, but muscle imbalance. So we have to correct those. So, so it's going to be hard to predict that. You can let me know in a couple of weeks. Yeah. So yeah, it's hard for me to predict that. But you know, the doctors do have pain medication for you. I know that some patients are kind of, I don't want to take a lot of pain medication, but from my experience, a lot of them do end up taking it. And I respect the right that you don't want to get hooked. Some patients don't want to get hooked. And so they'll take the least amount as possible. But don't wait until your pain is a 7 or 8 because the pain medication may not work by then. It's a cumulative effect with pain medication. So just kind of keep it under control when it's time to get a pain medication. Does that help a little bit? Sorry, I can't answer. Okay, all right.
I was just wondering, but normally it's not that excessive? I mean, I've talked to a lot of people I have.
Yeah.
They say it's not, but I just...
Yeah, there are a lot of success stories out there, but sometimes we remember the not success stories. You know, so we'll hear that one story about that person who has a tremendous amount of pain or just not walking very well, but there are 8 or 10 other people who've had a great experience with this. Once again, I can't be a predictor of that. Is it more painful than a kidney stone or having a baby? I don't know. So, I don't know.
I got a quick question.
Yes, sir.
I need it done too, but
Okay.
after on the artificial knee or whatever, would I be able to run
Okay.
or
Here,
walk?
you know the joke? Doctor, will I be able to play the piano after my surgery? Oh yeah, good. Great, because I never learned to play the piano. Okay, so if you're a person who did not do a lot of running prior to, you're probably going to have some difficulty running. But if you are a runner, good, congratulations. and you've worn out your knees, then the muscles are ready for that. Okay, you just need joints that aren't hurting every time you run. So, but I mean, if some patients are, once again, if your goal is to be able to run or jog, then yeah, you can work on that. You can tell the therapist, that's my goal, and they can put you on a treadmill, then they'll start speeding it up after a couple weeks, and speeding it up, and then hopefully we can reach that goal. Okay, all right, does that help?
But the knee is designed to take that, it can take that.
Yeah, I'll tell you, my father-in-law was 70 years old when he passed away, and he was running 5 days a week. At 70, he was running 5 days a week, and he didn't have a lot of knee pain. That wasn't an issue. So his body was conditioned to running. The joints were conditioned to running. Fortunately, he didn't wear out his joints. There's some genetic factors involved, not just weight and being on this earth. So there are other genetic factors involved also. So if that is your goal, I would do that. Maybe you may start running in the pool, working on that movement in a pool, and then gradually work your way to land. Okay? All right. So 6 to 8 weeks. So hopefully you're passing around Halloween candy without a walker or a cane and not having too much pain with that. Okay. Let's talk about car transfers, okay? So in other facilities, I would have an actual model car. This is my model car, so bear with me. So the easiest vehicles to enter and exit are probably minivans and mid-size SUVs. Okay, but all I have is sedan today, so I can't accommodate all makes, models if your car is lifted or lowered, whatever. Okay, so a lot of you may be getting into the car right like this right now. Let me just back up. I would recommend that when you're ready to go home, you're going to go butt in first and then pivot in. Some of you probably do this already. Okay. So the difficulty with a knee replacement is bending that knee enough to get through that car door. Okay, so I would push the chair back as far as possible. I don't care how short you are. Push the chair back as far as possible. You may want to recline it just a little bit to get that knee. You may get that extra inch to clear the knee. The best thing I could do for hip patients is as you sit here and as you pivot to bring both legs in at the same time. And of course, as you exit, reverse the process. Okay? Any other questions about cars? No one wants to know if they can drive? Okay. I'll answer that. Okay. People do ask. So for me as a physical therapist, when you come to my clinic and want to know about driving, okay, I'm going to say, well, is it your left knee or is it your right knee? And I can work on getting that knee moving really well, range of motion and reaction time. For me, the issue is not the surgery, it's pain medication. Okay? If you're taking pain medication is a narcotic, okay, and that can alter your reaction time or your perception. And you know, if you're a half a second slow on that brake, you endanger yourself and my grandson. Okay? So if you are serious about driving, try to get off that pain medication, then just talk to the doctor. Some doctors allow their patients to drive based on their circumstance. Also, you know that there are people out there driving who have no business driving. Okay, so I know that you will make responsible civic decisions when it comes to driving. Okay, does that help a little bit? Okay. Let's talk about stairs. So once again, I can't accommodate how many stairs you have, how tall they are, is there a rail, 2 rails, So let me just show you the basic how to go up one step. So the basic rule here is up with the good, down with the bad. The good go to heaven. Okay, thank you. Okay, so if I'm going up steps, I will step up with my non-surgery leg first. Okay? And then when I step down, I'll step down with my surgery leg first. Let me back that up, okay? So when I step up with my non-surgery leg, my stronger leg will power me up. Make sense? Okay? And when I step down, it's not my surgery leg that does the work. It's actually my strong leg that lowers and does the work. Okay? And then I could take some pressure off my surgery leg when I get down. Okay? So the good go to heaven, bad go to hell. DME, which means durable medical equipment. So we're talking about walkers, okay? So when you're ready to go home, you'll probably need a walker. Standard government issue, gray aluminum with 2 wheels in front, okay? Now, I would recommend, first of all, is that you borrow a walker, if you can borrow a walker, okay? Maybe for a couple of weeks, for a couple of months. The reason why I say that is because the goal, again, is not to walk on the walker. The goal is to get off the walker, walk with a cane or nothing else, right? So if you just need the walker for a couple weeks, then after you finish with it, return it back to the owner and say thank you, give them a cake, and then thank you for letting me borrow your walker, okay? The next recommendation is, if you need to get a walker, is to buy a used walker, okay? You can find a used walker for $10 at Goodwill or Rescue Treasures if you live here in Visalia, okay? Or if you have time, you know, you can scour some yard sales or garage sales. You can find a used walker for $10, okay? Now, if you haven't been able to get a walker, and then it's the day of your surgery, and you say, I'll need a walker when I get home, the case manager can talk to you about making sure that you get a walker that they can charge through your insurance when you're ready to go home, okay? There are also those 4-wheeled walkers, young lady in the back there. So with the 4 wheels with the brakes, like she's sitting right now, that you can sit on, okay? If you are planning on getting one of those, if you haven't had one yet, I would recommend that you get checked out by a physical therapist first, because sometimes those walkers can move a little bit faster than you're used to, and I want to check to make sure that you're going to be safe enough to set those brakes, turn around safely, and then sit down, okay? Great. Any other questions about equipment? Okay. So the last topic I'm going to cover today, ice management, and then we'll wrap things up, okay? So after your surgery, most likely if you're having a lot of pain, we usually go to the direction of putting ice packs on you, okay, knee or hip, all right? Our recommendation is 4 to 6 times a day, no more than 20 minutes at a time, okay? I'll repeat. 4 to 6 times a day, no more than 20 minutes at a time. Okay, so when you put it on there, put it on your knee or your hip, 20 minutes. After you feel the coldness and the numbness, then you can take it off, maybe half an hour, and then you can put it back on. It has to come off your body though. Don't just move it from here to another part of your body, because the body can't tell. It just responds to the cold. Do you want to know where those 20 minutes comes from? Would you like me to explain to you? Okay, you've heard it, 20 minutes. Why 20 minutes? Okay. If I was in Minnesota in February, okay, and I'm walking across a pond, and I fall through, the first reaction of my body is to preserve the brain and the heart, preserve the core. So it shunts the blood out of my arms and legs to make sure that the brain and the heart are still moving, okay? So I've been in the water, help, it's been about 20 minutes. No one has come to help me. The body does an interesting thing at 20 minutes. It says, hold on, we still need those arms and legs. So it shunts the blood back out to my arms and legs. Okay, so after about 20 minutes, the body does a reverse of what you want it to do with ice and or heat. Okay, let me give you another example. I was working at another hospital, not this one. Lady comes into the ER with knee pain, so they give her an ice pack. What happens in the ER? You wait and wait and wait, okay? No one told her they left the ice pack on her knee for 4 hours, okay? And because of her medical condition, she later had to have that leg amputated because of complications, okay? And I will continue telling that story to drive home the fact, no more than 20 minutes at a time, okay? Now, if you go to the Broderick Pavilion, I think they talked about the Broderick Pavilion, sometimes they have a really big, bulky dressing on you, and if you know, you're not, I'm not really feeling that coldness, if they leave it on for half an hour, I'm okay with that, okay? But a limited time, 20 minutes to half an hour at a time. All right. Well, folks, that is the mandated information I need to present to you. Do you have any other questions before we wrap things up here? Yes, ma'am. Okay. We call that a game ready. Okay, and that's usually prescribed by the doctor. So the doctor will have to prescribe that. So what it is a machine that the doctor prescribes, and it's hooked at this tub of water, okay, and it pumps cool pull water through the certain device here to cool down the leg or the whatever the body part. Now I remember putting one on. I remember trying one of those things probably 13 years ago, and it was only 40. The water was only 45 degrees. And that's not going to be cold enough. But when I put it on, it did feel like an ice pack. Okay, and usually those machines do have a 20-minute shut off. So.
You have them over here at the therapy.
Okay. Yeah.
And it's 10 minutes.
Oh, 10 minutes?
Yeah.
Okay. So whatever the manufacturer has an automatic shut off for it. So once again, you're not going to have it on for a very long time.
What are they called?
They're called Game Ready. Game Ready.
Game ready.
Yeah.
It's really, I mean, in my opinion, it's not something you really need at home.
Yeah.
When you go to physical therapy after you do your in-house therapy, if necessary, when you go to physical therapy, I know across the parking lot, they have them.
Okay.
And they'll use them there.
It's also faster just to get an ice pack from the
Yeah.
freezer
Yes,
and put it on.
and it's a lot less expensive.
Yeah. Do you want me to talk about ice packs? Are you okay with that? I can give you an explanation how to make your own ice packs. Go ahead. Okay. So if you want to make your own ice packs, 2 parts water, 1 part rubbing alcohol. Okay. Put that in a Ziploc bag, seal it, put it in a bigger Ziploc bag, so you have double Ziploc bag. When you freeze that mixture, it doesn't become rock hard like water does. So it becomes a little bit more gelatinous, especially around the knee. So you can wrap that around the knee. Then you can refreeze it. Okay. 2 parts water, 1 part rubbing alcohol. Rubbing alcohol.
Rubbing alcohol?
Rubbing alcohol. I don't want you to be sucking on ice packs. Boy, my knee.
What about Jack Daniels?
No, rubbing alcohol. I can't say what the freezing temperature of those things are.
But they don't, alcohol doesn't freeze.
Yeah. So,
I mean, even liquor,
Yeah.
I mean, alcohol doesn't.
but yeah, that's kind of expensive ice pack though.
But nevertheless, we're gonna stick to.
Oh boy, here we go. Okay, so thank you folks for coming here today. Thank you for choosing Kaweah Delta. We know you have a choice right now, but good luck to you in all the rest of your rehab.